Yes, you are the star of the show.
Oh my God. It's 7:12. Sabrina Salas Mantonani, Jason Salas, Joe Sir here. Your four-person wrecking crew on the link. Proudly brought to you by Calvo Select Care, Dial Rentone, IT&E, and Calvo Enterprises. Good morning. It's Friday. Friday, woohoo! 7:13. Let's go into the KUAM News Zoom room. Okay. Where we're bringing on, we have GHRA's Mary Rhodes from the Guam Contractors Association, James Martinez, and from the Physicians Advisory Group, and also, of course, the AMC Clinic family, Dr. Hoa Nguyen. Good morning, everyone.
Hey, good morning, Chris.
Good morning, Mary.
Good morning.
Good morning, Dr. Hoa.
Good morning, guys.
Good to see you again.
Yeah, always, as always.
2 days in a row is not good.
Yeah. So we're here. We brought you guys on because we have a big announcement to make about GHRA and their new Tanat Homlu Islata program. And so basically, this is.
Jason, what is it, Jason?
What is it, Jay?
What's it? Nala?
The Natla Homlu I Islata. You said Tala Homlu.
I don't
No,
know.
because
I'm looking at
the
this when you're
sheep, the
printing.
sheep.
Yeah.
You setting us up, aren't you?
Yeah. Anyway, so it's basically translates to "Let's Heal Our Island," and we're going to go ahead and give. I think Mary's going to take the floor here because she knows all about it, and we're just glad to get you on here and unveil this testing program here with GHRA. Good morning, Mary.
Hi, good morning. I sent Jason a copy of the presentation. We're really appreciating the opportunity to share this with you. GHRA has been working on this for some time now with the Guam Recovery Group. And next week, we have our virtual membership meeting on December 10th. If anyone wants to attend that, we are inviting all of the media to be there as well, where we're unveiling this. So today is really an exclusive offering with regards to sharing this with Dr. Nguyen, together with an announcement that we've started working together with the Guam Contractors Association as well. So with that in mind, the program is really a pilot program, which we actually have submitted to the governor of Guam so that we can work on getting CARES Act funding. And so that's why we've taken some time to release this because we really, definitely wanted to get the governor's support and work with public health on this pilot program. And so we're still working together with her team. We've been meeting with public health regularly on trying to find ways in how to incorporate this to augment what public health is doing. So as soon as Jason can share that screen.
Yep, it's up, Mary. You're good.
Oh, it's up?
Yep,
Sorry, I don't see it. Okay, great. Thank you. So with that, I'm gonna go over the actual, the video. I'm sorry, not the video, the presentation of this. And what you'll see is on the, it's the actual process flow you're showing, page 12.
Yeah, let me.
Okay, great. So the pilot program is, again, a comprehensive community-based initiative in which all of our public-private sector partners are coming together, where we're getting a lot of interest with the employer groups to stand up safety officers within their companies so we could work together with them. The process flow that Jason is showing is really the process flow we put together with American Medical Center. And as you can see, yes? What's that? Okay, so as you can see, the example here is Black Construction, because they just attended our first training session with American Medical Center yesterday. And so it starts really the Nalahonlu y Islata plan, which is Let's Heal Our Island, starts together with GHRA leading the effort in getting employer groups to want to begin rapid testing for asymptomatic employees. So this is really an asymptomatic plan to get serology and antigen tests so we can look at antibody testing testing as well as antigen testing out in the private sector working groups, so that they are ready to work with public health should they have any asymptomatic individuals who are testing positive at the workplace, then need to isolate or go into quarantine if they come in close contact. So it's really a private sector approach to work alongside public health. So we're all working together to keep our island safe, reduce transmissions, prevent any major outbreaks, and then also to get our public health to begin contact tracing together with the employer group so we can be more efficient and more effective in getting this process going. So once GHRA is notified by an employer that they want to be part of this program, the employers will get training and all the tools that they need in order to participate in this program. And then together with GHRA, we would upload, once we have an agreement with the employer to start this, we would upload their data into a digital contact tracing software. We've made presentations to public health with this digital contact tracing software. It's made by 360 Clinic, and it's a software that's currently being used in California. And this software, it doesn't matter what test is being used, it can actually track real live data, real time. It can track serology, antigen, PCR testing. It takes all tests. So it's not biased in the fact that it can only be used for one type of test. It takes all universal tests, whether it's FDA, EUA approved. The rapid test that Dr. Nguyen has access to and has already gotten the vendor has brought in shipments is actually FDA, EUA approved. And so once the employer is signed up, they would upload all their demographics so we could schedule the testing site. I did provide a copy of the protocols, which I can go over, Dr. Nguyen can go over in a little bit. But once the testing dates are scheduled, then that's when we go on site with AMC. And we have trained several safety officers to stand this up at their employer sites. So we could start to do testing following the universal protocols that we've shared with public health. So once the testing begins, then we would test initially the first 100% of all employees would be tested, and then we would follow up the following week with another set of tests for antibodies using serology testing, and then we would continue to take those. The employee would take that test. The results come in about 10 minutes, 10 to 15 minutes. So immediately on that same visit, the results would be uploaded to the digital contact tracing software, and as you can see, once it's uploaded, public health would be able to see it via a secured cloud that they'll have read-only access to. The employee will also get notified, and then the employer group would have their own portal, which is limited. They won't have access to everything. They're only going to see the reporting on how number of employees, if they tested negative or positive, and then when they need to reschedule those employees who tested negative to come back for testing the following week. If we do get any positive results, then we would work with the employer group to follow the public health protocol, where they would call in public health and start the isolation procedure and contact tracing process. So at all points, we do include public health in this process. We're not replicating what they're doing. We're just really expanding their services so that we can start taking care of employer groups and asymptomatics. Now, this doesn't have to be limited to just private sector companies. We have proposed that this can also be implemented at public agencies that are, having issues such as the airport or down at Port Authority, even DOC. So if we are able to get CARES Act dollars, this can really serve a greater purpose in testing regularly our government, public sector, as well as private sector employees who have continued to work this entire time through the pandemic. So again, public health would be notified, and we would go through and continually test until either a vaccine is found, or we would continually test even if a vaccine is available, because we have to be careful. Guam is only going to receive a certain number of vaccines, and then who are those vaccines going to go to, what specific populations or specific working groups. So I think it's going to be really important that people understand that access to the vaccine will be limited. And so we need to continually test And then the other piece about this, which I'd love Dr. Nguyen to talk about, is really more the reason why we're doing this is also to set up a surveillance survey. So we're constantly screening and creating a baseline for our community. So I'm going to have Dr. Nguyen talk about that, and also the universal protocols that we've shared with Dr. Erica Alford at AMC.
Dr. Nguyen?
So,
Unmute, Doc.
Jason, that's page 15, if you want to show that.
Okay. Anyway, thank you so much. Thank you, Mary. Anyway, this is some program come up because initially with the some employer group, when it turned positive, it's very hard. Everything is done manually, and it's very hard for the physician to manage the company, and also they just keep getting the paperwork back and forth. So we were thought about get something on the digital platform that everyone can see, and is make it very efficient. That we can number one is give the general manager or the HR a bird's eye view of everything in the company. Either they at home or they travel to the United States, anywhere they can, they just push a button, everything there they can see, just like we have the EMR in our clinic. So they can see who's positive, who's negative, when they tested. They can see if the person, their HR did the contact tracing. They can see if public health go in there and do the investigation. So everything at the push a button rather than have to carry the paperwork from one place to the next. So there's two prongs to this one. One is that we're going to start with seroprevalence, mean that the first round is that we're going to do an antibody test on 100% of the employee, just to let us know to see if, hey, in the past, this employee have been positive in the past. As you can see, it's important because we learned from the recent outbreak that probably 80% of people that turn positive asymptomatic. That's how they spread to the next person. We see that in real life, and that's reality that we see on certain companies that we work for. So the seroprevalence is very important because we need to know if they've been sick in the past, they have immunity or not, and the question is how long the immunity is going to last. And that's something that even the seroprevalence, we're going to do serial every 2 months. We're going to test them to make sure that they still seroprevalence positive. And the surveillance part is the most important thing. As you can see, public health do a lot of surveillance tests right now with antigen tests. It's rapid, and you go to the site. You don't need the machine, and you can do a lot of them at the site. You don't have to go to the clinic. And again, the surveillance program is a serial surveillance program. So every 2 weeks, you're going to take 10 to 15% of your workforce and test them and try to catch the asymptomatic as much as possible to take them away from your workforce. So that way you don't have major disruption of whatever job that you have in the community there. So the surveillance program is very important. It's a serial surveillance program. We go back every 2 weeks and do 10 to 15%. And that's something to go forward. It worked in a lot of community in the past. So those are the two-pronged approach that we try to get the company to have the least chance of going to a major disruption of their work. Again, we don't want to invent anything out there that already exists. So we partner with 360 Clinic in California. They have a huge program out there in Orange County. It's been run since the start of March of last year. So they have a pool and track ready. So we just pull them in to help the private sector and make sure the workforce is healthy and to prevent any type of disruption. Now, this program is run parallel with public health. We augment public health stuff. So when public health come into a company that have a positive, it makes things a lot easier for them. Again, everything will be digitized, so all the record will be there. Public health, after someone turned positive, the company will start the contact tracing and document everything on the digital platform. Public health get notified immediately, almost just the next 5-10 minutes that someone positive, and they can come in, see everything done on the digital platform. They read all the notes from the HR, so that way they can do their own investigation. Every company will have access to their employee database by themselves. They cannot see each other data because it's on the cloud base by group. So you have an identifier to go in there and look at your database. So it's an excellent program. We didn't invent anything new. We just bring another program for another place of work, and we implement it to a private group, augment public health in this fighting pandemic, because the economy and everything is dependent on the private sector to move forward. So they just take the initiative for doing that.
Thank you, Doc. James?
Yes, thank you, Chris. Actually, the Guam Contract Association joined in this process because what attracted us most was the rapid testing component of the that they're proposing here. The Contract Association has their own pandemic and mitigation plans that is used by a lot of our, especially our smaller contractor members who don't have a big health and safety department. So they utilize the plan that we use. Again, not without reinventing the wheel, we're using the National Construction Standard for Pandemic and Mitigation Plan that's used widely through the U.S. However, what that does not incorporate is a rapid testing, surveillance, and monitoring plan. And when Mary and GHRA, GDB came up and introduced us to the rapid testing component, I was kind of excited because this is the one piece that was missing in our pandemic and mitigation plan. So we're very thrilled to be a part of this. And this is going to provide a safer workplace, especially in the private sector, and also free up the resources for Department of Public Health and Social Services for the community at large, and not worry about the private sector. So it's kind of like a self-policing type of arrangement. And, we're more than happy to do that. And of course, our employees, our top priority is going to make sure that they're working in a healthy and safe environment. And this is one way to accommodate that. And we're excited about launching this plan and launching it with our members too, in conjunction with the GHRA, GDB, and other organizations who are part of this effort.
Yeah, this is a great plan. We would definitely encourage GovGuam to support it. I mean, you're using the administrative infrastructure of the employers to screen and stop the spread, Mary.
Yeah, this is a very, like I said earlier, it's a comprehensive plan. The rapid testing and surveillance survey is very key. But what we've also noticed is a lot of the employer groups, both public and private sector, really want additional things in order to be more effective. And so I've shared on the screen that this plan that we work together with the Guam Recovery Group, which is led by, Dr. Annette Santos, John Rivera, Dave Tidingo. They've made presentations in other locations with other groups in the past. So this one has gotten really a lot of traction the last 2 to 3 months, and we're really grateful for a lot of their efforts. And so we were able to submit our proposal to the Gov and tie in GDB as well, because there's another part of this. There are really 2 pillars that we suggested, and one is the clinical rapid testing and surveillance survey, which we are already launching with AMC. But the effort that we're launching right now, just to be clear, is private sector approach together with public health on a self-pay basis. So some employer groups already need this in order to reopen or to continue operating. So some businesses who are doing better, federal services business with the military, they need to get tested before they access like the military ships who come into port, things like that. So we're already going to be starting with those companies on a pilot scale basis on a self-pay. But we're really hoping, again, that the governor supports this and we can make this on a much wider approach. The goal with the zero prevalence survey is to test 10,000 people, and I can share that section if we have more time on how we're going to get to the 10,000 on a monthly basis. But the other pillar, which I really need to share, is a partnership that we've created with GBB, and it's to really identify health and safety protocols. Right now, everybody has submitted their reopening guidelines. And there are some pieces that we feel strongly needs to be enhanced, but also additional things need to take place. And so with the Guam Recovery Group, in partnership with UOG's SBPA office, we have really created a Guam Safe Certified program where it would tie in with what GBB is hoping to launch at some point with the World Travel Tourism Council. And so that would be really tying in with DPHS, their DEH division, to get just more out there with regards to health and safety protocols, understanding the inspection checklist, and also doing more to provide training, education, training, certification, and also risk assessments. If you look underneath at, I'm going to go to this next slide for the risk assessment. It's not just about your pandemic plan and your reopening guidelines, but it's also your contact tracing protocols, your engineering controls, what did you do for your workspace modifications, your cleaning and disinfection protocols, crisis communications, when do you notify the public, your employees, employee families, and then reopening, but also closure plans, and then looking at self-audits and inspection checklists. We've shared this with the Division of Environmental Health, with Public Health, and we're hoping that they fully support this, because when it's, we are hoping to create this in the next 3 months with GBB and with UOG's SBPA office, because we're hoping we're going to create the curriculum and the education and training and outreach, community outreach, so that we can train all these safety officers so that they can start bringing this into the workplace. Because, you know, we're seeing a lot of the issues have been congregate places, whether it's single room occupancy or in the workrooms, break rooms, things like that. So by giving more training, resources, materials, and doing some e-learning as well, we're hoping to better educate the employer groups and then start educating within their businesses. So we're hoping to launch that as well later on. But like I said, this is really part of a bigger picture with working with public health in identifying all the needs that the employer groups are needing at this time. So we're very grateful that Guam Contractors Association has signed on. This is an example of our three-month pilot program where we would already establish the criteria. We've already contacted some employer groups. We're really looking at a mix of industries, both public and private, to launch this with, so we could make up our 10,000 minimum participants in order for AMC to get their zero prevalence survey completed.
Well, so it's not just GHRA members, Mary.
Well, GHRA is, you know, we have active hoteliers, we have restaurateurs, but remember we have allied members. So companies like KUAM is a member of GHRA. Right, yeah. We have all our distributors, you know, the supermarket, we have airlines, banks, wholesalers, all of these businesses. And we actually have an associate membership where the government agencies are also members of GHRA because we run the sports leagues, right? A lot of them join because of the sports leagues, but GHRA is made up of all these industries. We just have different categories for them. Right, we have hotels, restaurants, allied, and then associate for government and non-government. And if people are wondering why GHRA, GHRA really has been sitting at Homeland Security, and we take care of private sector in a lot of emergencies. Right. And so this really makes a lot of sense. We partnered with DEH in the past when we did a 6-month outreach when they changed the Guam Food Code. We did 6 months of community outreach education and then also training where they brought in all the mom and pop stores, all the businesses who needed to convert, you know, their coolers and chillers and everything that you need to comply with the Guam Food Code. We have partnered a lot with different government agencies over 20 years, 30 years in doing this. But more recently with public health, we've been their partner when we have to do community outreach programs. So we've done this a lot, and we hope that, this will continue to grow. But we also hope to gain the full support so that we can do this on a much larger scale.
Mary, oh, good.
No, I was just going to ask you, what was the feedback from the governor when you presented this plan? And what happens if you're not able to secure CARES Act funding?
Well, again, the governor has received a second request for that proposal, and it's together with GVB for the Guam Safe Certified program with the risk assessment tools. So that's still in motion. We did still request the second pillar for the rapid testing and protocols. At this time, we're moving forward on a private sector level with Guam Contractors Association, which is why it's so key we have James here, because he has really reached out to his employer groups to sign up for this program on a self-pay basis, because a lot of them still need it in order to reopen and to show with public health that not only are they submitting their plans, but they're putting in mitigation efforts, and now they can do rapid testing. And we've also received interest from other businesses in these key industries that need to show that their workforce is COVID-free.
Right, yeah, that's
so I think that's really the key, is we provide the services to those who want to participate on a self-pay basis. Just so you know, this is 1/3 the cost of a PCR test for each employee. So it is more cost effective, and the rapid response on it, again, is 10 minutes. But the fact that it's all tied in with testing, reporting, and managing your data and regularly seeing so you can manage your workforce. You can use a lot of the data to identify where they're at, which locations they're at, who's actually has more of a prevalence of getting the infection, where the infection started, on what test date. There's a lot of data that you can actually create an epi curve from using pivot tables. And so by entering the data and going electronically, digital, like Dr. Nguyen said, is extremely important if we're going to have a better chance of mitigating and remaining open during this pandemic period. And I know I keep saying that over all our interviews, but
hey, at least
really
you're consistent.
Time to get it done.
You're consistent, Mary. But I wanted to talk about with the CAR score and the promises that have been tied to the lowering of the CAR score. I mean, the governor has pretty much said that if we keep it at this level, that on December 15th, 16th, we could see easing of further restrictions. So I wanted to ask, how does this program play into kind of the allaying of these public concerns? I mean, I see it in the comments all the time, like, people clamoring for, businesses to test their employees. And we've seen with the amount of openings that we have now, maybe the public a little timid about going out. So in your opinion, with this testing program, with the full support of Gov Guam, would it kind of deliver that peace of mind to people who want to go out and enjoy a reopened economy?
Yeah, the nice thing with technology is you keep adding on to it, right? And you take what's being used elsewhere. Like I said, this system has already been in practice in California for some time now, and they've looked at new technologies. So the way employees and employer groups will be notified, they can be notified via email as well as SMS, texting, and WhatsApp. But what's really cool is in a couple of weeks, they're going to have a QR code app that every person will have as an identifier. And so what really the future of this could be where GHRA and even Guam Contractors Association. But imagine if you're able to go out to a restaurant and use your QR code to show your last test date, to prove that you've been tested regularly and you're continuing to remain negative, or you've already had it and you're already safe from it. So even with the CAR score going down, and even with soon we're going to have a vaccine. Again, not everybody's going to have access to it. And the CAR score has so many other factors involved that it's reliant on other things. So what we want to do is provide a solution, regardless of what happens externally with the community and with the government and how they decide things. We need to reassure ourselves as employer groups. We need to reassure the public, the community, especially our guests in the future if we're going to reopen Guam for tourism. So we need to put systems in place now, regardless of what the CAR score is and regardless if we get a vaccine. Yeah. We need to put a proven, reliable, effective, and fast system that has real-time data where we can monitor this and manage it better.
All right. Thank you, Mary. Very in-depth presentation. It looks like it'd be a great thing for Guam. Hope you get that support. Maybe we could get someone from the governor's office to come on and talk about this with you next week. Doc, anything in closing?
No, just Mary say a lot of things already. The bottom line.
Yeah, she brought a whole PowerPoint.
It's really, really true. Is that we have this pandemic here. We have no idea when it's end. Even when the vaccines are here, it's not going to be the end of it. Because even you have the vaccine, the immunization, you still have a risk of getting infected. So it's not like we're going to get the mask off, I think, for next year or two. So this is a way that the whole Guam, the private side, the public side can move forward. Again, it's real-time data is so important for everyone to know, to identify. So that way, we don't have to call and ask someone if this person is negative, positive the last time or whatever. Everything there we can access with the pushing of a button there and see everything on a computer. Everyone have a smartphone. Everyone have an iPad. So technology does make things very simple. So we just have to jump on it and try to control this pandemic here by the use of technology and digital and work smarter. And that's the way we move forward. So it have an instantaneous notification to the patient. Someone turn positive, someone turn negative. You don't have to wait for a few hours or the next day or 2 or 3 days from now. It's just instantaneous notification. That helped a whole lot in our effort to mitigate this virus, from everyone else. So again, I hope that that this program take off because we really need it. We're going to expand more, talk more, and as the pilot program move forward, we will show some results from this, and hopefully, everyone on Guam will be on board for this. Okay.
James, was there any final comments you'd like to say, James? James, was there any final comments you wanted to make?
Oh, I'm sorry. Yeah, I just want to mention that one thing about this program is of course, when you say rapid testing, it is really rapid. We don't have to wait for hours or even days for this, but it also prevents the wholesale closure of an entire industry for maybe incidences in a couple or three contractors like we've seen in the past. So this is kind of a way to monitor that and to present to whoever's looking at closing an entire industry because of infections in a few areas. So this is going to help the industry a lot. And so hopefully that we'll get more of our members to jump on this bandwagon and do the testing. And, we've got to live with this COVID-19 for a pretty long time. It's not going to go anywhere or go away anytime soon. So this is going to be something that's going to be practiced pretty much on a regular basis for, God knows how long. But it's a, I hate to use the term new normal, but I think this is the new normal for the industry and for the community in terms of testing for this COVID-19. So it's a good program, and I'm going to encourage all our members to jump on this bandwagon and be a part of it.
Mary, can we kind of close? As I wanted to talk about, you touched on it during the interview, the safety officers within these companies.
Yeah, I think it's really important, when we have pandemics and now with COVID taking as long as it has and really impacting everybody, I think this is really an opportunity to create a new skill set within companies and individuals. This could also lead to job creation, where maybe you didn't have a safety officer in your company, and maybe now it's time to implement one. And so even some companies like Black Construction, they sent 5 people to our training session yesterday. Some other companies sent 4. So they really see the value in this. And so it's more than one person's responsibility. Of course, everybody has to include health and safety in their jobs today, but to have ownership of it and to create subject matter experts. That's the whole point of the Guam Safe Certification Program, is we're hoping to provide all these tools, resources, provide the training and the education, and then at some point do the Guam Safe certification. So when we say we are safe and we have these we implement all the protocols and we can do self audits, we can show through that stamp of approval from GBB that Guam is truly ready to reopen for tourism. But before we do that, as I've always said, we have to do it for ourselves. And so this is really an opportunity for businesses to create safety teams and to bring in those tools and resources and educate their employees so that they can truly partner. When you call in public health needs to be able to rely on the fact that the companies have done some of the heavy lifting. Because to rely on public health to do everything, it's just really, it's not fair. And also it's just really challenging, right? For them, they're limited as well, and they're spread out for the whole community. So I believe James and Dr. Nguyen both said this is really to help augment what they're doing, expand their reach, and allow us to do as much as we can to share information through a digital process where it really cuts down a lot of the steps involved and the manual processes. So it really is a win-win-win for the government, private sector, as well as the community as a whole.
All right. Thank you, Mary.
Well, thanks, Mary. Thanks, Dr. Hoa. Thanks, James. It really is a breath of fresh air. A breath of fresh air to hear about and to know that there is a program and discussions about how we are going to heal our island. So thank you so much. And hopefully it gets the attention it deserves from
thank you.
office.
Again, I just want to invite everybody to our December 10th meeting. We will actually have a demonstration from the contact tracing software program and also the rapid testing program with 360 Clinic. They're the vendor from California. They're here on island, and we're conducting training every week for businesses that want to sign up. And so I want to thank AMC for opening their doors and making sure that they're been a great partner in bringing in the vendor and providing the training opportunities for this. And just to be clear again, we're only doing rapid testing for serology. The antigen portion will be conducted by AMC themselves. So it's a really team effort, and everything is shared with public health throughout the entire process.
Thank you, Mary. Thank you, James. Doc,
you're welcome.
Are we able to get you to unpack the meeting last night, or what? You busy?
No, just update you a little bit.
Okay. Thank you, Mary. Thank you, James. You guys can hang out if you want. By the way, there's virtual lobster empanada in the KUM News Zoom room. Yeah, try it out. Yeah. There's a deal on lobster, so try that out.
Thank you.
Of course, Mary. Thank you, James. Doc Hoa, go ahead. If you could unpack the Physicians Advisory Group meeting that happened last night.
Yeah. Okay. Yeah. So, our car score have been doing very well, and thank you so much for the people